Hello, my viewers. How are you today? Hope all is well. It's me again, your daughter, your girl, Aunty Abidoc. I hope I met everybody okay. Today's message is about heart disease. We're gonna speak about heart disease, and the main one we're going to talk about is atherosclerosis. I repeat, atherosclerosis. And I will start by defining what atherosclerosis is. In atherosclerosis, the wall of the arteries becomes thick. It becomes so thick because of the build-up of fatty deposits. The fatty deposits are called plugs. When this happens, the flow of blood is restricted. So, atherosclerosis can happen throughout the body, anywhere in the body. When it happens in the arteries of the heart, it is known as coronary artery disease. If it happens in the arteries of the leg, it is known as peripheral arterial disease. Atherosclerosis happens over a period of time. It doesn't just happen suddenly, but it happens over a period of time. And its consequences can be so great, including heart attack and stroke. Okay, what are the risks? What are the risk factors of atherosclerosis? One is tobacco smoking. Two is high blood pressure. 3 is high blood cholesterol. 4 is insufficient physical activities. 5 is obesity. 6 is diabetes. 7 is poor nutrition. 8 excessive intake of alcohol. Other risk factors are beyond our control, and we cannot do anything about those ones. And these ones includes age, gender, family history, ethnicity, such as people from South Asia, Africa, Caribbean. But we can reduce this risk of atherosclerosis. And how can we? How can we achieve this? We can achieve this by making healthy lifestyle changes. And this can help us to reduce the risk of developing atherosclerosis and may help us stop it getting worse. So the main ways you can reduce risk are: 1, to stop smoking. Stop smoking, please. However, it's not easy to just stop smoking suddenly. If you're finding it difficult to stop, you can get advice and help. So I give you this number. You can call this number. It's 0300 123 1044. I repeat, it's 0300 123 1044. Yeah. Or you can call your GP or go to the doctors. And you can ask them about stop smoking help. There's a lot of help out there to help you stop smoking. You can also ask for stop smoking treatment. It's all available. Your doctors, your nurse, the GP, they can all help you through this. 2, have a healthy diet. Avoid food that are high in cholesterol fats. Avoid food that are high in saturated fats. I beg your pardon. We need to avoid food that are high in saturated fats. Okay, what are saturated fats? Where can we find them? In what food? Could they be hidden? Which one? Which food? Okay, they are in butter and loads. They are in pies. They are in cakes, in biscuits, in fatty cut meats. They are in sausages. They are in bacon. You can find them in cheese as well as creams. Remember, an average person should eat not more than 30 grams of saturated fat a day. Please avoid too much salt. That keep coming in many of the diseases. Salt intakes appears. Remember when we're discussing about hypertension, high blood pressure. Now it's appearing here again. So there's something about salt that we must make sure that we avoid too much of. Also, avoid too much sugar. Aim to eat 5 portions of fruit and vegetable a day. 3, exercise regularly. Aim for at least 150 minutes of moderate aerobic exercise every week and strength exercise. Okay, talking about moderate aerobic activities. What are they? Which ones are they? Number 1, walking. Walking is simple, it's free, and it's one of the easiest ways to get more active, to lose weight, and become healthier. Dancing is another one. Whether you like to jump, or shake your hips, or your booty, dancing is one of the most enjoyable way to get moving. Regular dancing is great for losing weight, and it allows you to maintain strong bones. Riding a bike, whether you're cycling to work, to school, to shops, or for fun, cycling is a good way to get more active. Okay, so what are strength exercises? What are they? Strength exercises are those that strengthen the muscle. There are many ways you can strengthen your muscle, whether at home or in the gym. Examples of muscle strengthening activities are 1, carrying or moving heavy loads, such as your groceries. Activities that involve stepping and jumping, such as dancing. Heavy gardening, such as digging and shoveling. Exercises that use your body weight for resistance, such as push-ups and sit-ups. Yoga is good. Yoga is an ancient form of exercise. It focuses on strength, flexibility, and breathing to boost physical and mental welfare. That's what yoga does. 4. Maintain a healthy weight. Maintain a healthy weight. Aim for body mass index, which is BMI, of 18.5 to 24.9. The good thing about BMI is that you can calculate it yourself. And I will teach you how you can. First, you need to know your weight. Secondly, you need to know your height. So the formula is like this. Divide your weight, which you have already measured in kilograms, by your height, which you have measured in meters. Then divide the answer by your height again. I will work out an example. For someone whose weight is 70 and the height is 1.75, the person's BMI equals to 70 divided by 1.5, which is equal to 40. Then divide 40 by 1.75 again. And that will give us 22.9. So the BMI for whoever has the weight of 70 and height of 1.75 meters, the BMI is 22.9 kg per meter square. Number 5, moderate your alcohol consumption. Very important. Men and women are advised not to regularly drink more than 14 units of alcohol per week. Nonetheless, there is talking about treatment for atherosclerosis. There aren't currently any treatments that can reverse atherosclerosis. I will say that again. There aren't currently any treatments that can reverse atherosclerosis, but the healthier lifestyle, those healthier lifestyle changes that we suggested in the beginning may help stop it from getting worse. Nonetheless, sometimes additional treatments to reduce the risk of problems like heart attack and stroke may also be recommended, such as there's this medication called statins. It's used for high cholesterol. Another medicine is for high blood pressure. Medicine to reduce the risk of blood clots, such as low-dose aspirin, dietary changes, and medication to treat diabetes. All this treatment can reduce the risk of problems like heart attack and stroke. But having said that, please, no self-medication at all. If you need any of this medicine, you need to please talk to your GP or your doctors who will then prescribe the right dosage for you. Thank you so much for watching, and I hope we're able to pick one or two things out that will make us, more conscious of what we can do for us not to have heart attack or stroke. I love you all. That's why I'm sharing what I know with you. Until I come your way again with another type of disease, what we can do to prevent them, the definition of this disease, as well as the treatments. I say I love you all. Remain blessed. Thank you. Love you. Bye. Thank you. Bye-bye.